All right. Well, welcome. It's 1:06. A couple more people are logging in. I'm going to let them get set up, and I will get off to a slow start here and just kind of introduce myself for those of you that are tuning in for the first time. I've done a few of these now, and this is a little bit of my background. I'm originally an OB-GYN. I'm based currently in Atlanta and Athens, Georgia. Athens, Georgia is where my practice is. That's a medium-sized college town market, home of University of Georgia. So we have a really good patient clientele. And I used to teach at Emory University and broke out on my own and started to rethink medicine, both from a standpoint of wellness as well as aesthetics. Went completely aesthetic and wellness, dropped the hospital stuff back in 2005 and then 2008. 2008, I also founded Practical CME Medical Training. We are a boutique medical training company that is has sites all over the country where we do hands-on training. We also have CME certified online, one of the few companies to have fully CME certified online training as well. You can see those are the sites around the country where we do hands-on. And we have partnered with DP Derm to offer the only CME accredited online microneedling training course there is out there. And maybe some of you have shopped around getting med mal insurance, adding procedures to your practice. And as you know, you need training. You need proof of training. They're very strict about it. And you need proof of accredited training. And that's what it will show on our certificate. So when you go to dpderm.com and click on the CME course link, you will have access to this course. And I posted over in Q&A. Now you can find Q&A by looking at the bottom right corner of your screen under activities, which is the triangle, square, and circle icon. And I posted the link to this course. That is not where you purchase it, but that's where you can see the entire course outline in great detail. You can read our CME certification credits and all of that important stuff before your purchase. Then you can go over to DP Derm and purchase it. You will get an email with your login and password. You will get 2 years of access with free updates. And there are going to be a lot of updates. Microneedling is always changing, and it's quite exciting. I'm very excited by it, and I'm glad to be here tonight talking to you about packages, how to counsel your patients. So this is an extension of last week where we talked about how to talk to your patients about microneedling, because microneedling is a somewhat moderate awareness procedure, maybe not as aware medical microneedling, at least in a provider's office, does not have the same awareness that, say, Botox does. A lot of patients not only know what Botox does, they know the names of the muscles, they know what dose they need, and they're just looking for someone who's really good. In this situation, they're looking for someone who's really good, but they also may need a little convincing as to what microneedling does. So we talked about that last week. You can access that recording. Now you have that interested patient, and we want to talk about how to turn that interest into a steady stream of treatments that will benefit her and benefit you at the same time. So we are going to talk a little bit about money here, and money and earning money from procedures is frowned upon in CME courses. I don't talk about this a lot in the course itself, but we'll definitely touch on it here. And so we'll talk about patient selection, how to make sure you get the right person that's going to do well, and then re-up, order another package, how to plan that package, what are the elements of a treatment package, and then finally, how you should determine the cost, because everyone's costs are different. Now, this is new data. I purchased my DP4 pen a little over a year ago, and it replaced my skin pen and my Micropen Evo. I usually took one of them on the road with me for training, and I used the other one in my office, and I would bounce back and forth between the two. And I used the glycerin glide that came with the skin pen, and generally use just a plain high molecular weight hyaluronic acid when I did treatments with the Micropen Evo. I have been doing microneedling in my practice since 2014, and I've gone through a lot of pens. I have 3 pens that are not FDA cleared that I used prior to SkinPen being cleared way back in 2018. Then I bought the SkinPen and the MicroPen Evo, used those, and the DP4 is my 6th pen. And I have no need for the others, because what happened is, after all these years of doing it, as soon as I introduced this piece of equipment and these products, now it's been 1 year and we've noticed a doubling of initial treatment packages sold. So somehow it's bringing more patients in the door in the first place, and we're not advertising, so I'm not really sure about that. It's tripling the number of treatments performed. So the number of microneedling treatments we have done in the last 12 months compared to the prior 12 months is triple. And we have 5 times the rate of package renewals. We do a package as a package of 4 treatments. And generally speaking, the number of renewals was pretty poor with the old pen and products. People would do their 4, and then maybe we'd see them back for 1 more, but we might not get the whole package again. We are actually seeing, for the first time in my career, people re-upping on their package at treatment number 4, buying 5, 6, and 7, 8 immediately on their way out the door. So what's the difference? It's not me, it's the equipment and it's the home care. So think about, some of you are doing microneedling already. What are you using? How is your pen helping you make money? How are the products that are paired with that pen helping you establish these long-term relationships with your patients and get real results where they want to go out and tell the world what kind of incredible life-changing effects they are getting from a series of microneedling treatments? Think about how it's working, because there is a difference. The problem might not be you. The problem might be your equipment. Why is that? Well, first of all, if the pen itself is not FDA cleared, you should not be using it for hire in any practice. That is definitely wrong. As soon as these pens gained an FDA status, you cannot use it in trade. So that means anything sold on Amazon and anything that's not FDA cleared. There are 6 currently that are cleared. And so that's an issue. But even some of the ones that are cleared are lacked, as I discovered in my experience with 2 of those 6 that I mentioned above, compared to this system. So keep that in mind. Some of the things I've also found issue with some of these non-FDA cleared pens is that the needle heads are very dull. There are issues with leakage, with body fluids being in the pen itself after you remove the needle head, which shouldn't happen. And then the last thing I've noticed, and I really didn't pick up on this until I was doing a year's worth of these, is that the depths were wrong. When I thought I was dialing up 0.5 millimeters on my first pen that I ever had, it was barely even touching the stratum corneum. So everything was underdosed. And so it was really frustrating at first. And now with this one, I don't have to worry about any of that. So to pick up where we left off last week, let's talk a little bit about how we present the procedure to patients. First of all, it's natural. Everybody wants natural stuff. And my whole practice, whether it be bioidentical hormones or how we approach weight loss, we really try to stick with things that are natural. And there's nothing more natural than simply making some clean, sterile punctures at a certain depth that is predetermined in the skin and letting those channels heal. In webinar 2, we talked about all of the medical literature behind the channels themselves and what they do. The progress is gradual, and that's great, because nobody is going to walk up to your patient after 1 treatment or 2 treatments and said, "Who did that to your face?" Whether it's good or bad. People want to be kind of secret about it. And you know what? If they want to talk about it, let that be their option. The downtime I really consider minimal. And I tell my patients, it's really just same day downtime. And it's not even down. You know, you can still go to the store. I just don't want you outside in the bright sun at your child's soccer practice that afternoon. You know, so there's a few things we want to do. You can still get in the shade and go out. That's fine. but really there's almost no downtime when you do these procedures the way we teach in that CME course. The discomfort is minimal. We have learned a lot about how to manage discomfort. DP Derm gives you an option that you can purchase without a prescription. We also talk about the BLT creams that you can purchase with the prescription in the course. So you have some options there, and it's incredibly customizable, which I love as a science geek, and that I can alter the depth, the interval, the serums, and the home care regimen, and I can change it up as I go. Meaning if I'm focusing first on scars, but then I want to focus on pigment, we can change that stuff up. And finally, this is one of the most popular procedures worldwide. It is maybe not as popular in the US as it is in Asia and in some pockets in Europe, but still, we are not the first. There's nothing experimental about this. So then we get into the full face evaluation. One of the first things I like to talk about is what's your current home care regimen. When was your last procedure on your face of any kind, whether it be a chemical peel or a toxin or filler or PRP injections or anything, you know, thermage, heat-based treatments. And then we start to break down the issues. And a lot of times patients will have almost all of these issues right on the same face, which is really important to point out. Now, the FDA on-label indications for microneedling are acne scars and fine wrinkles. However, we have a lot of off-label things that are very well described in the medical literature, and we've got great evidence as far as the depth, the duration, and the serums that we need to use to get the best results. So pigment, glow, texture, other scars on the body, not just acne, but possibly a cleft palate scar or a trauma scar, even rosacea, active acne. We've seen some new evidence on vitiligo, which is in the course, which I'm really excited about. And then, of course, for scalp. And some people would call that hair. I prefer to call it scalp. So then you've got to say, okay, who are my best candidates? Because I want to try to invest my time in the people who are going to get the best results, because that means better word of mouth, helps my reputation. Younger patients do tend to respond quicker, but that's not an absolute. It just gives you a little bit of a framework. For instance, if you're dealing with pigment on someone who's 30 versus someone who's 50, you'll probably get quicker response in the 30-year-old, unless the 30-year-old slacks off on their home care, doesn't wear sunscreen, and continues to hammer away at her melanocytes. And then I'll take the 50-year-old. Either way, I'm taking both. But just keep that in mind. I don't like to make too many promises, but sometimes when people pin me, I'll say, okay, yeah, you know, you're under 40. I mean, I think by the end of that first package, you're going to know what microneedling is going to do for you and if you want to continue. So patients need to understand fully that this is an ongoing treatment. We price a single microneedling treatment at half the price of our package of 4. We price it so high, we don't want anyone to buy one microneedling treatment because, frankly, they can't really make any conclusions. Yeah, they'll know what the discomfort is. They'll know what the post-care regimen is like, but really they're not going to be able to see any results. We never promise any results like that after one. So that seems to be a useless exercise. So we overprice the one treatment because then maybe patients will take that, multiply it by 4, and see the value of the package. The other thing I really love in my practice, and you can do this for one indication at all, but I like people who have multiple targets, because then that's when I can have fun by changing up the depth and changing up the serums as they go and keep them into it and keep them wanting to renew. Talked about this last time. Aging is the ultimate down escalator. So when you counsel your patients, they need to understand that if they do nothing, they are going to hit the floor. If they decide to turn around and start walking slowly, they may stand still or hit the floor later. And you must turn around and run if you want to turn back the clock. And you can turn around and run with microneedling, but you've got to hit your marks. You've got to do your packages, and you've got to keep that interval, the serums, the home care, and the preventive treatment all in place. So what are the components of a treatment package? So number one, it's got to be enough treatments to see improvement. And I like 4 for this. You could do 6. You could do different treatment packages for different indications. There's probably a pretty good reason, if their indication is mostly pigment, to bundle 6 or even 12. I don't want to have too many different items in my practice, so I keep them all at 4, but there's a reason why you would want to do more if you want to. Jumbo packages, tell the patients, you know, hey, we can do more. It'll be a little bit less per month, and you lock in the pricing because everybody's worried about inflation. Everybody knows prices always go up. And then you have to determine the interval, and that's going to be based on the patient's needs. And we talk about this in great detail in the CME course, but the interval may be as short as 4 weeks. The interval may be as long as 8 weeks, for instance, if their primary endpoint is scars. So when you think about it, 8 times 4 is 32. That's a long time. So they're making that one payment, and nothing will come out of pocket again for 32 weeks. In that case, for scars, maybe even as little as 4 months for pigment. And then you must make sure that that treatment package includes everything they need. You don't want to have to nickel and dime them. So what we do in our package is we include the post-care, and we deliver all of that post-care for 4 treatments at treatment number 1. Why? Because they're paying us for the whole thing up front. We might as well give them all the products up front, and then can try to get the patient to pre-schedule all the appointments. That gives them the date and the time that they want, making sure that they are scheduled so that they can come in 30 minutes early to wash and apply their anesthetic, because that's going to be really important for patient comfort. DP Derm has these home care starter kits, and this is a slide from the course explaining the breakdown of the contents of each kit. And you see there are different cleansers, different treatments, different corrections, different hydration. They all have the cover recover for protection, which is essential while those microneedling channels are open. And so you see there are 4 different home care starter kits that you can stock in your office, and I hand the patient one of these. If a patient is going to use this regimen, they should have enough stuff to treat 3 days after each procedure for a package of 4, meaning this kit should last them 12 days with one exception, and that is the mask. And so I do provide extra masks at the time of purchase of the package. So when they pay for package number 1, we hand them their starter kit. We leave it completely closed, and we leave that one mask inside. We hand them 2 more masks for treatments 2 through 4, and then we can either give them the 4th mask to use immediately when they get home if they need to get home, or we'll apply that mask in the office immediately after the procedure. If they don't do the mask in the office immediately after the procedure, we want the patient to do it in the next 2 or 3 hours. So we just want to make sure they have enough extra masks. There are 2 different kinds of masks, the HA mask and the bright light. And again, all of this stuff must be used for 3 days post-procedure, no exceptions. I also stock larger versions of these home care items. So like the larger bright light BL or the vitamin rich repair, or the cleansers. We stock larger versions of that because some people will use a lot of product. They will burn through their home care kits, and they can purchase those at a reasonable price. I do sell these for a little bit less than retail in my office, just in case people go online to look for it. I don't want them to think they're not getting a great deal by sticking with us. Then we also have to say, so picking the post-care item is pretty easy. There's not a lot of choices there. There are 5 choices here with the Mesoglide serums. So what those are serums that come in small little 5 ml bottles that you will use on the face as you perform the procedure. So generally I'll smear that on one area, do my 3 passes at the proper depth, check for my endpoint, and move on to the next area. Put serum there, do that side and so on. We have a number of narrated treatment videos in the course that'll go through everything. In fact, people always ask, do I need hands-on training for microneedling? And the answer is probably not really. You know, we've designed this course to get you the basics so that you will be ready to treat your first patient after watching the course and all the videos. But one of the important things to decide at the beginning of treatment are the mesoglide serums. Which ones am I going to use? MGHA 35 is sort of a good general all-purpose. 35 plus, I like in patients over 40 or 50. Deeper wrinkles, we got a little bit heavier lift. RAS for scars, Bright Light for pigment, and CLR for acne. All of these serums contain high molecular weight HA called Hyalofuse. And so this is not just glycerin, which the first FDA-approved pen gives you to use during your treatment. This takes it so much further. Now, the mesoglide serums are not meant to be sent home with the patient. This is just for in office. Okay. So now let's talk a little bit about the numbers. What's the wholesale cost of a package? Because you need to know your wholesale cost before you can determine your retail cost. And something that if you have an active practice right now, you may not even know which procedures are your most profitable, and you may not even know that you're losing money on other procedures. You can't just choose pricing out of the blue. You've got to come up with a scientific formula for your price. So here's how I would do it. The first thing that's the hardest is determine your cost for 15 minutes of office time, because that's about the amount of time you are going to be in the room with the patient doing the procedure. And what you need to do is calculate your entire monthly overhead. That includes everything it costs to run your business, like employee salaries and rent and your insurance and utilities, things like that. Nothing related to the procedure itself. Don't include what you pay for Botox in there because you're not earning that back. It's not a Botox treatment. Just your monthly fixed overhead. Okay. And basically, you're going to divide that by the hours you're open per month times 4. Why times 4? Because there's 4 slots in an hour. And that will basically tell you what your fixed cost is for 15 minutes of office time. So if you earn that, you keep your office open. Now, you don't get paid, and you don't pay for your the cost of the procedure, but at least that's the bare minimum. And you add on top of that the fixed costs of a microneedling package or a microneedling treatment. In this case, I'm adding the fixed cost of the entire package. So this would be 4 treatment heads. Now, if you use this equipment, that's only $100. 4 treatment heads with the pen I used last was $240. And so that's a problem. So since I switched from that pen to this pen, I now have $140 more to spend on good stuff, like the starter kit and the MG serum. So you can see how that works out and why I've built, it's the fastest growing thing in my practice, because I kept the prices the same and I took the $140, and instead of buying $60 heads, I now buy starter kits and MG serum and get better results. Everything above this becomes your margin. And that's how you get paid. So make sure you have a good understanding of your numbers. You always need to know your numbers. So we're going to bundle the 4 treatments with the home care. And then when it's time to explain the pricing, nobody wants to drop a whole lot of money up front. So yeah, you can say the total. $899 for 4 treatments is what I currently charge. Okay. But if you look at it another way, 4 treatments at 6-week intervals, which is my standard interval for anti-aging, that's 24 weeks or 6 months. That's $5 a day. Okay. Full-on microneedling package to meet your needs and to help you turn around and stop the clock, if not turn back the clock, is $5 per day, inclusive. Okay. Get that in your head, because it's not a whole lot different as the prices for some of the other things we do, like toxins. Or you could say it's $150 a month. Okay. Now, also, the other thing you're going to tell your patient is when you did your initial evaluation, you're also finding out what kind of expensive serums they might be using or all kinds of, well, let me tell you something. If you're putting expensive serums on intact skin, you're only getting about 7% absorption anyway. So maybe they can stop buying some of those things, because the stuff in that home care kit put on needled skin is going to do them a lot more benefit than some fancy name brand $100 serum is on intact skin without the needling. So they may be able to even save money on their home care. What are the expectations? So now that we got them for 4 treatments at these intervals that I mentioned before, with a home care regimen for about 3 or 4 days later, we talk about improvement around treatment 4. Now, if a patient volunteers that she feels like things are better, oftentimes I'll hear that from folks, or improving at around treatment 2 or 3. I tell them, you ain't seen nothing yet. This is a curve. This is not a straight line. And if you keep hitting your marks and you keep doing your home care, it's only going to get better. So just keep it up. We are battling decades of pigment and decades of aging here, and we're trying to reverse it in months. As I finish up, you know, I like this slide, the algebra of microneedling. I've used it a couple times before, but just in summary, the beauty of microneedling is this: the healing response, the natural healing response you get from these channels and from the punctures is always greater than the trauma, meaning that skin is better off after microneedling than before. The cellular function on a cellular level improves better than that patient's age baseline, meaning you biopsy that patient's skin after a series of microneedling treatments, they will look younger than when you did it at baseline. You're always going to make healthy collagen, not scar collagen. And scar collagen is the problem if there is infection or if there's heat-based procedures, lasers, things like that. Your dermal thickness will also improve greater than your age baseline. Along with that cellular function, they go hand in hand. And the safety is always way greater than lasers. You know, one of the biggest risks of lasers is you're so darn scared of it, you undertreat. And that doesn't help anyone. But the therapeutic index for lasers is really narrow, and there's no way around the fact that heat creates scar collagen. Scar collagen doesn't line up like this and stretch. It's tangled and mangled. So talk to your patients in terms of that escalator, in terms of the clock. Do they want to slow down the clock, stop the clock, or turn back the clock? And design your packages to be aggressive enough to meet their needs, and then set the goal far enough in the future, and you will have a return patient. So that's all I pretty much have to say now. That's where you'll go if you click that link in the Q&A. And I'll open it up for questions. And again, any questions, please type in the Q&A, which is the bottom right of your screen, triangle, box, and circle. And I will go on ahead and answer them as I see them pop up. Do I combine microneedling with other treatments? And I've talked about this in, I think it was the first webinar about synergies with microneedling. So you'll probably want to watch that. Although the full answer is of course, in the CME course, where we go into it in great detail. But yes, we do, but it's not done as a blanket thing. It's done on a case-by-case basis. Other modalities may be added after we start a microneedling package, or it may be done at the beginning, and it's based on their pathology. So things I could combine with microneedling would be platelet-rich plasma, Botox, fillers are all things I can combine. Now, they are not, you know, necessarily synergistic with microneedling at the molecular level. PRP maybe, but they all help to achieve the same result. And of course, say you're working on crow's feet and you're working on upper forehead lines, and you're really going at them good with microneedling, but you're letting those muscles constantly contract and wrinkle the area even further. It's going to be harder to get up that down escalator, so you're going to need some Botox with it. So that's kind of my answer. I do combine it, rarely on the same day, with the exception of PRP. And PRP use is limited. I know there's a lot of pictures out there of people walking out of doctors' offices with the clotted blood all over their face. But when you really look at the medical literature, I think you're going to do better in the vast majority of your packages using the serums that are here, instead of adding that extra expensive PRP, with a couple small exceptions. But I don't go on ahead and sell PRP for someone who walks in and says, cash is no object, I need to run up the down escalator, give me all you got. Well, if they don't have the right pathology, I'm not going to do PRP if it's not going to help them. In fact, it may even be somewhat pro-inflammatory, for instance, if you want to work on pigment. Where can we get access to the previous webinars? I believe they will email you the link when that comes out. I believe they are on the DP Derm website. Practical CME does not host them on our website, but they should be on the DP Derm website. If you click on where it says CME course, I think you can access them there. If not, contact your rep. Sure, I'm not sure if I missed this, but what medications would be contraindicated to needling? So whenever we talk about a needle on the skin, of course, we always think about blood thinners, right? But because we're not really going too deep, we're not cannulating actual vessels, I would consider that just a possible contraindication. I still would try it. I would go real superficial and see how the patient does, but I don't consider someone on blood thinners to be a contraindication to me. Other than that, topicals can be a contraindication, and topicals like Retin-A or fluorouracil or things like that prescribed by a dermatologist for certain conditions, you don't want to put that on needled skin. Needled skin is extremely vulnerable. And so at the least, you're going to go on ahead and stop that, as well as anything that is a strong acid, anything stronger than ascorbic acid or vitamin C, I don't want on needled skin. Now, after the needling channels close, they can resume those treatments. So those are some of the things. Again, the course talks about it in more detail, also talks about which patients should be excluded and why. Francis, do you include the aftercare kit within the bundle of 4 times $8.99? I do. I do include that aftercare kit, and I showed on my costs, it is about $100 wholesale. So I can still get a better than 50% margin, well better than 50% margin, including the needle heads, the aftercare kit, the serums used, and the additional 3 masks. Exosomes and benefits with usage with microneedling. Yeah, we're going to do another webinar about that. DP Derm's got some new products out, and we're going to talk about it. I'm old school. I'm evidence-based. I like to see split face studies, and I like to see clinical studies on real people. So I'm eagerly awaiting to read that. The theory behind exosomes and the contents of exosomes, should they be able to get in the needling channels, which we believe they do, and have the same potential effect the same effect as your own growth factors, then I think exosomes are going to be a game changer in the next 10 years, and they could very well replace using topical PRP in the cases where PRP would be indicated. But right now, the answer to that question is it depends. MGRAS is used only for scars. What serum do you prefer for wrinkles? So deeper wrinkles, I like the plus, the HA35 plus. Let me go back to that slide. I like the HA35 plus for when wrinkles are the primary issue, patients over 50. RAS, I tend to use mostly for scars. There is some overlap between the two, but that's just kind of how I break it down. Be interested to know if you have different experience with it in your situation. Pregnant or breastfeeding women, request to treat stretch marks when they are still pregnant or have just given birth. So from that standpoint, you have to think as a provider, you know, what am I doing? What am I doing to stress the patient? What am I doing to potentially introduce something into their body that is potentially harmful? And so you've got to think about what are the aftercare items I am putting on the skin. If I'm using lidocaine on the skin, how much of that potentially is going to get absorbed? If I am placing vitamin A containing products on needle channels, potentially how much of that will get absorbed. So there are definitely some worries. I will tell you a story as an old OB. You know, pregnancies are really, you just don't know. And I had a patient who was 36 years old, came in for an amniocentesis, laid down on the table. We ultrasounded her. She had a massive pocket right where her umbilicus was. This is going to be the easiest amnio in history. I was so excited. I could go right in the midline. She wouldn't feel a thing. And right as we were getting ready to put the needle in, she said, "Stop. I decided I don't want it." I'm like, "Okay." We talked about it. She says, "Yeah, I'm only 36. I'm like, "I agree with you. That's fine. 1 in 150 chance either way." She broke her water and miscarried that night, and we didn't even touch her. So of course that would have been blamed on the amnio, and she would have blamed herself about it. You just never know in pregnancy. And so any kind of intervention, if there is an unrelated bad outcome, it's going to come down on you, or it could come down on you. So you just have to keep that in mind. There's no hard, fast rule. The stretch marks, granted, you know, they probably had the stretch marks before they got pregnant too. You'll be able to do a great job on them after they deliver. Now, breastfeeding, I'm not worried about that whatsoever. Pregnant, you got to really think about it. But breastfeeding, I'm not worried about that. There are very few things that are actually contraindicated in breastfeeding. When using the DP4 pen, is the aftercare similar to the needling? Well, is the aftercare similar to other needling for aftercare? I'm not sure exactly of what, the rules you're asking about, such as no products for 24 hours outside. Yeah, so I let them use everything that's in that kit for the first 3 days. And they resume regular care on day 4 at home, unless, again, they're using something prescription that is a little harsher, like I mentioned earlier. So that's kind of how I do it, but that's why I love the kits. The cleanser, the serum, the hydration, and the sunscreen is all microneedling compatible. Whereas if you go and just put glycerin on their face, needle them, and then send them off to Walgreens to get something compatible, they're going to smear stuff with colorings and perfumes on it, and that's going to be a problem. When combining with chemical peels, do you apply the chemical before or after needling? Why are you doing a chemical peel when you're doing microneedling at the same time? I guess that's my question, because when you microneedle, you're making lots of little channels, which are creating lots of tiny little diamonds of dead skin, and you're already getting a fantastic exfoliation. Plus, then your products are going straight in through the needling channel. So chemical peels are designed to try and soften dead skin when you don't have a microneedling pen. So I would not combine this with chemical peels, frankly. I think you're going to do pretty darn well with this alone. Now, chemical peels in between treatments, that's an art, and I'm all for that if you feel like you need it, but I wouldn't mess with that at this point. You really don't want someone to get overly inflamed from a treatment. We just want a nice, healthy healing response. All right. Well, thanks a lot. I appreciate everyone for attending. Sorry we went a few minutes over. Happy Halloween, everyone, and we will see you again in November. Have a great night. Goodbye.